We have an appointment for a full body medical checkup today. When was the last exam that you had, Alessandra?
I want to say it was like 6 months ago.
And is there anything in particular bringing you to today's visit?
Yeah, actually, my jaw has been very tight. It feels a bit locked on both sides, and I feel like just like chewing or just like doing anything in general, like just it feels so uncomfortable. But yeah, it's been happening for about a few weeks now, and I don't know, I wanted to see you and get this checked out.
Okay, I'm happy you came to see me. I can definitely check that out and see what could be contributing to this.
Thank you.
So it started a few weeks ago. Do you remember maybe doing something in particular when the pain first?
No, it just all of a sudden, I really have no idea where it came about.
Okay. And on a scale of 1 to 10, how intense is the pain?
I want to say like a 7, maybe 7.5.
Are you taking any medication to manage that pain?
No.
Has anything else changed in your health recently? Any other symptoms?
Actually, I mentioned I'm having some stomach issues too. There's been a lot of like sharp pain in my abdomen, completely unrelated, but yeah, that's been plaguing me a bit, and it's been kind of stopping me from being able to do things. But yeah, actually, that's kind of got in the way.
Okay, so abdominal pain accompanies the jaw tension. And are you able to bend down, pick up something, turn? Is any, range of mobility restricted because of the abdominal pain?
Just a little bit, yeah. I mean, I don't think I'm a complete invalid, but it does get in the way, yeah.
Mobility is limited. Have you experienced any headaches or any blurred vision or double vision since these other symptoms started?
I feel like my vision's been okay, but I have had a few headaches.
Okay. And where are the headaches localized?
My temples, and then kind of the top of my forehead as well.
Okay. Do they happen more often at night or throughout the day?
Throughout the day.
Okay. Have you noticed all of these symptoms getting better or worse throughout the time?
I want to say it kind of just stays the same, the little...
Okay. Are you allergic to anything? Have you developed any new allergies?
No.
Are you on any regular medication?
No, not right now.
So no prescription medication, nothing over the counter?
No.
How is your sleep? Are you sleeping well at night?
My sleep's... I mean, I have been sleeping less. This has kind of been getting in the way of my sleep. I still finally sleep around, like, I guess 2 a.m., but it takes a bit.
Sleep quality is impacted. Confession time. Who else loves smelling like luxury but hates spending a fortune on designer perfumes? This used to be me, but not anymore. Enter Dossier, a brand that is revolutionizing the fragrance game. I've been wearing Dossier fragrances for a while now, every day, and let me just say, my perfume collection has never looked better or smelled better. With Dossier, you can own high quality scents without spending hundreds of dollars. You can even order up to 9 scents at once, making it easy to find your new signature fragrance. Ambery Saffron, inspired by MFK's Baccarat Rouge 540, which retails for $465. With notes that linger all day, the saffron and orange blossom scents will steal your heart. Dossier only charges $44 right now, a fraction of the cost for the same exact smell. Just look at the quantity, 50 milliliters in each bottle, filled all the way to the top. Magnetic top is just an amazing perfume. I also got the Ambery Vanilla, another favorite of mine. Ambery Vanilla, inspired by YSL's Black Opium, which costs $130. This is the ultimate confidence boost smell. Why not get it from Dossier for only $26? The exact same smell, a fraction of the price. You must check out the Gourmand Orange Blossom scent. It's divine. Gourmand Orange Blossom perfume, inspired by Lancome's La Vie est Belle, which retails for $118. This is a true head-turning feminine fragrance that starts as a floral trio of jasmine, orange blossom, and orris, blended with a fizzy touch of blackcurrant and hazelnut. You will make an impression while wearing this perfume. It comes beautifully packaged, so it makes for the perfect gift. Click on the link in the description down below and use code LUNALAX10 for 10% off. You will get premium products at incredibly affordable price. Have you changed anything with your diet? Are you maybe eating any foods that are very hard to chew, like granola bars or nuts or anything just hard?
Yeah, I have been eating walnuts, almonds, not granola bars, but I feel like it's a good balance. I don't eat it too often, but...
Okay. If you're not eating that every day, that should definitely not be the cause of such, intense pain. Mm-hmm. Have you noticed any changes to your hearing?
No.
How about your sense of smell, your nose? Any problems with that?
No, they're fine.
Okay. How about your mouth?
My mouth, yeah, just like swallowing, just even talking. I don't even want to talk that loud just because it's like, I feel like it's a bit more exhausting now.
Okay.
Having to be able to like use my voice and speak. So yeah, for that, yeah, it does get in the way.
Do you get any pain right here?
Not too much right there. It's kind of stops around the jaw.
Localized around the jaw,
yeah,
mostly. So not radiating down.
No.
Are you able to turn your neck side to side? Good. Any pain when you do that?
Just a little bit.
So neck mobility is restricted. Okay. Any problems with your back?
No, there's a little bit of soreness, but I feel like that's always kind of been there, but nothing out of the ordinary.
Good. Any pins and needles in your arms, your fingers, your shoulders, feet, legs?
No.
Good. Do you exercise regularly?
I do walk on the treadmill, but I need to exercise more. I don't do it that often.
All right, so I have your medical chart here, and I updated it with all of the information you gave me. So let's go ahead and start the medical exam and I will take your vital signs first. I'll focus on your head, your jaw, and then your tummy as well. Are you in any pain right now?
Yeah, I do have my jaw pain. And then there's some stomach pain too, but I feel like it's dissipated just a little bit. But the jaw pain's still there.
And on a scale of 1 to 10, how intense is it right now?
I would say it's still about a 7.
So I'm gonna go ahead and take your temperature first. Have you had any flu-like symptoms in the last couple of weeks?
No.
Okay, let's go ahead and put this under your tongue and close your mouth and just hold it right there for me with your left hand. And I'm also going to check your level of oxygenation and your pulse. You can just rest your hand here. Okay, perfect. There you go, yes. 96.5. One, two, three, 4, 5, 6. Perfect. So that it reads 99% oxygenation and 84 beats per minute. No fever, normal oxygenation and heart rate. And your pupils are round and reactive to light. They are the normal size and shape in just regular room conditions. Good. I'm just going to take a look at your appearance and just observe your skin and the color. Check for any abnormal moles that may be highly visible. And I'm also going to look at the inside of your arm for any colors that may not belong on a normal skin, like purple, blues. Okay. I do see that you have quite a bit of moles, and they all appear to be just normal, one color, not elevated. Do you see a dermatologist on a regular basis?
I do not.
Okay. I do recommend that you see a dermatologist just because based on the number of moles I see on your chest here, You may have more than 200 throughout your body, and I also have the same. I have about 500 moles on my body, and I do see a dermatologist every 6 months. I also did not wear sunscreen when I was a child, so I have a lot of sunburn that I accumulated over the years. So based on that alone, I'm at high risk for skin cancer. But otherwise, your skin looks wonderful. Not seeing any signs of psoriasis, dermatitis, or anything that may be abnormal. Okay, I'm going to go ahead and listen to your heart. Okay. Is it okay if I touch you with my stethoscope on your heart?
Yeah.
Okay. Go ahead and breathe normally. I'm listening for any murmurs, any bruits. I'm able to hear S1 and S2. S3 and S4 are not present. Steady rhythm, not hyperdynamic. Good. I'm also going to turn the bow side and listen to the more superficial sounds. Good. Heart is normal, no positive findings. Okay, go ahead and take a deep breath in and deep breath in and out. Deep breath in and out. Good. Lungs and heart are normal as well. Did not hear any hissing or bruit. Lung and heart normal. S1 and S2 were present. No adventitious sound. Okay, next up, we're going to do some cognitive tests. And I'm going to show you some cards here and test your vision. Okay. So I want you to use your right index finger and trace the orange line. Good. Now I want you to tell me what number you see and then trace it.
8.
Good. Perfect. And now what number do you see?
9.
Good. think this one is upside down. How about now?
57.
Okay, good. This one is also upside down. Okay.
12.
Good. Excellent. Okay, now I'm going to show you some more pictures and we're going to try to identify the pattern. So these 3 square circles here, they follow a pattern, and I want you to pick one of the 4 circles on the bottom to complete the pattern.
I want to say the second one because they only have, each one only has 2 little triangles, and that's the only one that also has 2 triangles.
Yeah, very good.
Gosh.
So here we have one big rectangle, and each quarter of the rectangle has a different pattern. A piece is missing, so I want you to choose from A, B, C, D, and E and try to plug in to complete that pattern there.
I think C, because the diagonal line is going down, so is that one.
Mm-hmm.
Wait, actually no, because the lines are vertical, not horizontal. So I think it's E then, actually.
Very good.
Okay.
Yes, the lines would not intersect for E.
Yeah.
Okay, we have 3 squares again with black and white smaller squares, and they follow a pattern, so you need to choose one of the bottom squares to complete the pattern.
Okay. I guess the pattern would be that they're all touching. There's 3 of them.
The black ones, yes.
Can't be that one. Can't be that one.
Perfect.
Only leaves these 2. I want to say that one because this one they're all touching, and they're not all like connected fully. They're all, just almost connected. So
Good. So you use the process of elimination to get rid of 1 and 2.
yeah.
And then you just chose the most relevant one out of the last remaining 2.
Yeah.
That's good. Good thought process there. Okay, we have another picture here that's missing a quarter of it. So which one out of A, B, C, D, and E you'd be able to plug in there to complete the pattern?
I think right off the bat I want to say B because exactly like that one.
Most similar.
Yeah.
Good.
Okay, what do we have here? Okay, we already have the star, moon, circle, already the heart, so that leaves square.
Very good. None of the shapes repeat, yes. Good. That was it. So, full cognitive ability is present and no color blindness is observed. So, making a note of the fact that cognition is intact. Next up, I'm going to go ahead and inspect your cranial area. That involves me touching your head, palpating. Is that okay with you?
Yes.
checking for any lumps or bumps, indentations on your head, and asymmetries in the cranial area. I'm going to apply pressure. Is that painful?
No.
Is this painful?
No.
Pressing down on the mastoid bone process behind the ear. Is that painful?
No.
Good. I'm going to palpate your jaw. So just go ahead and relax. And slightly open your mouth. Good. I want to check your lymph nodes first, just to rule out anything else that may be systemic. So preauricular lymph nodes and posterior auricular lymph nodes are not enlarged. Can you move your head towards your left, please? Okay. I'm going to go ahead and check the occipital and cervical lymph nodes on your neck. Not enlarged. And over on your left side. Good. Not enlarged. Checking the supraclavicular lymph node. And the submental. Good. Now go ahead and slightly open your mouth. And I'm going to perform a little percussion. Let me know if you feel any pain. Any pain there? A little? How about there? Any pain? There. On a scale of 1 to 10. Can you open your mouth slightly? Good. Any pain there on that side?
Yes, a little.
Okay, let me go ahead and take a peek inside. Okay, can you open your mouth for me? Okay, and stick out your tongue. Say Okay, not seeing anything abnormal. Okay, and lift up your tongue. Okay. No signs of any infection or inflammation. Let's check for the presence of crepitus. Go ahead and open your jaw and close. Do it again and close. Good. I'm feeling a little bit of a clicking here. Also hearing it. Yep, definitely. TMJ may be what's causing you the discomfort. I'm gonna go ahead and make a note of this. So mouth exam was normal. Clicking was present when opening and closing the jaw. Pain upon percussion. Sensitivity present. TMJ is the primary candidate now for diagnosis. I'm gonna go ahead and just to be on the safe side, test the dermatomes and the cranial nerves that innervate your face, just to rule out anything that might be, more systemic going on with your body that's not just localized to DMJ. Is that okay? So I'm going to perform a very light scraping of your skin and just observe how it reacts to the touch. Good. No abnormal reactions. Color is preserved. Now I want you to close the eyes and tell me, where do you feel me touching you?
Yep, left arm.
Good.
On my collarbone. Forehead. My jaw on my right. Left arm. Right arm. Collarbone. On my nose. My left cheek. My right jawline.
Good. And now I'm going to touch you with either something sharp or cold. So continue keeping your eyes closed and tell me what you feel.
Sharp. Cold. Cold. Sharp. Sharp. Cold.
Now I'm going to cause a vibration and I want you to tell me when you stop feeling it. Do you feel it?
Stop. Stop.
Do you feel it?
Yes. Stop. Stop. Stop.
Very good. Okay, Alessandra, I'm going to take a look at your eyes next as part of the regular annual checkup. Go ahead and look into the distance for me. I want to make sure that pupils respond to light. Good. Perfect. Round and responsive to light, no concern there. Going to take a look at the optic disc. When have you had your last eye exam?
Oh, it's been quite a while.
And do you have any problems with your vision?
No.
No problems, good. Guys, I'm gonna go ahead and just make sure I have a clear picture. There we go, perfect. And I'm gonna come really close to you and just take a look at the optic disc. Continue looking in the distance. Good. Look up for me. Look down. Left and right. Perfect. Okay, let's do the same over on your left eye as well. Good. Gonna pull down slightly and then look at the margins of the optic disc. Good. So, well-defined ratio, good margins, optic disc looks intact. And take a look at the base of your eye as well. I'm just going to pull down on your eye here and take a look at the base. Good. And checking for any bulging. Can you go ahead and look at my nose? I'm going to go ahead and shine the light. Good. Can you look up for me? Perfect. And look up one more time. I'm going to take a peek inside your nose. No obstructions or discharge. Good. And I'm also going to verify your ears. Have you had any problems? You've mentioned no hearing trouble.
I have no hearing trouble.
How about any pain?
No.
Then go ahead and you can look towards your right. I'm going to verify that the ear canal is not obstructed. And take a look at the tympanic membrane. It's gray. I can see cone of light is present. A little bit of a buildup of wax, but in the normal amount. I do see a lesion. Do you use Q-tips by any chance?
I do. Yes, I do.
I'm able to see just a scratch, red lesion. So I'd recommend that you stop using them.
Okay.
But other than that, tympanic membrane looks good. I'm not seeing anything concerning. So left ear is good. let's take a look at the other one. Go ahead and look towards your left side. Inspecting the outside of the ear. Ear auricle looks nice. No external discharge. Let's take a look inside. Normal, healthy tympanic membrane. Bony landmarks are present. No discharge, no infection. So this ear looks perfectly healthy. Go ahead and close your eyes for me. I want to do a quick hearing test. So tell me which ear you hear a sound with, left or right?
Left. Right. Right.
Can you point towards the sound? Oh, sorry. Okay, good. So you hear it. And how about now?
Left. Right. Right. Left.
Good.
Left. Right. Right. Left.
Good. Hearing is not impacted. No positive findings. Normal ear canals with a red lesion on the left ear due to Q-tip usage. Recommend to stop that practice. Let's go ahead and lay down on the table, and next up I'm going to focus on your tummy and see if there are any physiological reasons why you're experiencing the pain. I'm gonna go ahead and start the abdominal assessment. Are you in any pain right now?
Not that much, just a little bit though. The sharp pain's still there.
Localized around your belly button? Okay. Is it okay if I lift your top?
Yes.
Okay, let's go ahead and expose your abdomen. And I will start by doing just a visual inspection. And how long have you had the belly button ring for?
I've had it for about 8 years.
Have you had any infections? With them, any problems since you've had it in?
I've had one before, but it's all cleared up now.
Okay. Yeah, it does look like it's very healthy. Skin looks normal. Going to look for the presence of any superficial indentations. I'm gonna go ahead and perform a cleanup around the belly button area. So I'm going to spray just a very light mist of saline solution. Make sure that we remove any debris so that I can perform a visual inspection that is sterile. Not noting any discharge or any abnormal reaction. I'm gonna go ahead and palpate next and check the abdominal cavity as well as the major organs. But before I do that, I'm going to auscultate. Check for the presence of any gurgling sound. Some gurgling is present, but these are normal sounds of a healthy abdominal activity. Very well. Not noting any abnormalities. I'm going to go ahead and take a closer peek at the belly button just to rule out anything that is microscopic. I'm not seeing any discharges. I'm going to change the filter to the UV light. No concerns. Good proportions. And I'm going to do a light superficial palpation. check for the presence of any masses or any abnormal sizes of your internal organs. Stomach is normal. I'm gonna press down on your kidneys. No pain is noted. I'm not feeling any masses. I'm also going to feel your pulse on the 5th intercostal space. That is the point of maximum impulse. I'm able to feel the pulse. Good. Just taking another quick look at your skin on your chest. Alright, let's focus on your legs and your feet next. Okay, so I'm going to continue the exam with an inspection of your legs and your feet. Any problems with your legs or your feet? Have you noticed anything out of the ordinary?
No.
I'm going to start off by doing the palpation to check for any edema or any pain. Tibia bone is intact on your right foot. Checking the patella, the knee joint, left foot as well. Any pain there?
No.
Any pain?
No.
Okay. Tibia bone is also intact on your left foot. Is it okay if I remove your socks?
Yes.
Okay, so I'm gonna go ahead and remove one sock. And the other. I'm going to do a light percussion first. Let me know if you feel any pain. Checking your toes. Capillary refills within 2 seconds. Can you push into my hands with your pads? Good. Perfect. Capillary refills within 2 seconds on your left foot as well. Can you push into my finger with your toe? Good. Can you push into my finger with your toe? Perfect. Palpating the pads. Checking in between the toes. Palpating the plantar region. Patient does not indicate any pain. Checking the pedal pulses for synchronicity. 2+ and synchronized. Can you lift one knee here? Yes, and hold it just like that. I'm going to test the nerves that innervate your toes. So go ahead and say, do you feel this?
Yes.
And is this sharp or dull?
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay. Now I'm going to touch you with something that creates a continuous touch, and I want you to tell me when you stop feeling it.
Stopped.
Good.
Stopped. Stopped. Stopped.
Good. Now you can lower this leg and expose your plantar region. Is this sharp or dull?
Sharp. Dull.
Good. Next up, I'm going to do the Babinski test on your right foot. Perfect. So there was a positive response there. You're able to detect a movement. Very good. Now go ahead and bend this knee. Perfect. And is this sharp or dull?
Dull.
Good.
Sharp. Dull. Sharp. Dull.
Good. And how many times am I tapping you here?
Twice.
And how about here?
3 times. 3 times. Once. 4 times.
Perfect. Go ahead and relax this leg. And is this sharp or dull?
Sharp.
And how about this?
Dull.
Good. And can you localize where I'm touching you?
My toe.
Good. Left or right foot?
Oh, right foot.
Good.
My knee.
Left or right?
Oh, sorry, left.
Good.
Right knee.
Perfect. And the Babinski test on your left foot as well. Good. I'm going to attempt to spread your legs. Don't let me do that. Resist. Good. I'm going to attempt to lift them off the table. Don't let me do that. Resist. Good. I'm going to attempt to push your toes towards your head. Don't let me do that. Good. And I'm going to attempt to bring your toes towards me. Don't let me do that. Good. Going to take a couple of measurements and check for the symmetry of your feet. 6, 6, 22, 22, 9, 9 across, 8, and 8 on the median. Good, okay. I'm gonna go ahead and put your socks back on. And we can discuss the results next. This completes the exam for today, Lysandra. I was not able to detect anything abnormal with your tummy from just a physical point of view. The organs are not enlarged, there's no discharge coming out of your belly button, so the problems may be digestive.
Okay.
Have you changed anything in your diet recently?
Not that I can think of.
No changes to the diet. Normal physical exam. Legs and feet, no issues. So no positive findings. And I also checked your cranial nerves. That also revealed no concerns. So I would say that you're in perfect health. I'm not sure what we are going to do about your jaw problem. I suggest that you see a specialist, a TMJ specialist.
Okay, that's good.
Okay, I think the problem is just physical with the connection of the jawbone, the cartilage that connects those bones there. You probably eroded it over time from grinding your teeth. So a TMJ specialist will be able to help you.
Got it. Thank you.
Okay, do you have any questions for me?
No, I think I'm good.
Great seeing you today. Thank you for coming in.
Thank you.
Hi, my name is Dr. Lux and I'll be your doctor today.
Hi, I'm Jamila.
Nice to meet you, Jamila. Welcome to my clinic.
Nice to meet you too.
So we have an appointment today for a head-to-toe examination.
Mm-hmm.
And that's a very nice accent. Where are you from?
Thank you. I'm from Kazakhstan.
Kazakhstan.
Mm-hmm.
And how long have you been with us in the country for?
It's been almost 6 years.
Oh, okay. Wonderful. Very nice meeting you.
Nice to meet you too.
Okay. Any concerns that bring you in today that I should know about?
Not really. Just wanted to do the full checkup.
Okay. And I see here that we don't have your medical records from Kazakhstan. So that's very good that you came for a full examination. May I please have your date of birth?
It's February 11th, 1998.
1998. Okay. Do you have any allergies that you're aware of?
No allergies.
No allergies. Are you on any medication?
No.
Have you had any major surgeries, any trauma to the body?
No surgeries.
Good. Have you experienced blurred vision or double vision any time in your life?
I have. It happened a couple of times.
Really? Tell me about those.
It happened just when it was very hot weather once, so I just felt like I losing my consciousness. So
Okay.
all the eyes were very blurry, and it was like very dark. But it stopped, maybe like in 2 minutes.
Okay.
It was scary.
So the hot weather was the reason why.
I think so, yeah.
And how long ago did that happen?
Maybe like 8-10 years ago.
8-10 years. And have you experienced that ever since?
No.
No. Okay. Any tingling sensations in your body? Any prickling, sharp pain, or zaps anywhere on your skin?
Sometimes on the face.
On your face? Okay.
Especially when the wind is blowing, I feel like my face is kind of tingling.
Okay. Have you ever been diagnosed with any neurological disorders?
No.
No. Okay. And when did you last have any blood tests done?
Last year.
Last year. Do you remember if there were any abnormal results, anything concerning?
No, it was good. Everything
Good.
was
Okay. Gonna make a note of that. And do you have any pain anywhere in your body right now?
No.
No.
No pain.
Okay. So what I'm going to do is a full body assessment from your head all the way down to your toes. I'll make sure to check for any neurological signs of any abnormalities. Yeah, we'll get a baseline on you.
Sounds good.
Great. Okay, I'm gonna start off by sanitizing my hands.
Okay.
I'm going to check your temperature. Okay. Have you had any flu-like symptoms over the last couple of weeks?
No.
No. Good. Okay, this is going to go over your forehead and behind here. 97.9, so very good.
Okay.
You don't have a fever.
Nice. I'm glad I do.
Good. I'm going to check for your levels of oxygenation in your blood. So may I please have your index finger? Okay, you can just relax. Okay, good pulse, 99% oxygenation, so no signs of any concern. Okay, I'm gonna go ahead and listen to your heart and your lungs. And I'm going to make sure that I sanitize the stethoscope first. This is just an alcohol pad.
Okay.
All right. Gonna start off by listening to your heart. Okay, it's a bit cold. You can just breathe normally. I'm looking for any murmurs. Any skip beats. You can just close your eyes and relax. Okay. I'm able to hear S1 and S2. I'm not hearing any additional sounds. Good steady rhythm, not hyperdynamic. Going to listen with the bell side as well for the more superficial sounds. Good. Going to check your lungs next. You can take a deep breath in and out. 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 Good. Okay, so no adventitious sounds, no crackling, no signs of pneumonia. I'm going to listen to your carotid artery as well, right on your neck, for any bruits. Good, quite normal. All right, I'm gonna set this aside. Okay. And I'm going to begin by palpating your head and doing a scalp inspection, and then I'll move my way down to your ears, eyes, nose, mouth, arms, abdomen, feet and legs.
Sounds good.
As well as the back.
Okay.
I'm going to grab my medical gloves.
Sure.
Any headaches?
No,
No headaches. Good.
that's a good sign, right?
Yes. Okay, I'm going to begin by doing just a light palpation. Checking for any lumps, bumps, tenderness. Going to apply light pressure. Okay. Checking the mastoid bone process behind the ear. Any pain here?
No.
Good.
Feels good.
Okay. Any pain when I press down on your ears? Good. Okay, I'm going to feel your head from the back.
Okay.
I'm going to do light tapping and percussion on your head, and let me know if you feel any discomfort. I'm going to percuss your face as well. I see your eyes flinching, which is a good sign of a sensitivity there. going to check your clavicles. Good. Good.
That feels so good.
Good. I'm happy that it was a pleasant experience. Next up, I'm going to just check your scalp really quickly and do a scalp inspection in the front of your head here. Okay. And then I'll focus on your ears. Okay. I'm looking at the distribution of your hair, the color of your scalp. No signs of folliculitis in the front or alopecia. Okay. Is it okay if I unclip your ponytail? Mm-hmm. Okay. Okay, if you can please look over to your left side and down. Good. Okay. Normal hair distribution. I'm going to check for any abnormal breakages next. Good. And over on this side. All right. Next up, I'm going to focus on your face, and I'm first going to check the skin, And we'll do a couple of sensory tests to make sure that from a neurological point of view, everything is okay. Alright, I'm gonna go ahead and begin with an inspection. And I'm looking for micro lesions, abnormal moles, any scars. Can you just close your eyes and relax? No lumps or bumps in the face. No moles. Eyebrows are symmetric, good hair distribution. Eyelashes are normal. The color of your lips is uniform. Okay, good. I'm going to palpate your lymph nodes next. Right. Going to begin with the pre-auricular lymph nodes over in the back. And if you can now move your head towards your, yes, left side, good. Post-auricular in the back. And pre-auricular lymph node in the front. Parotid right next to it. Tonsillar. Okay. Not enlarged. Occipital in the back. D-neck lymph nodes, superficial cervical, deep cervical, and posterior cervical. Okay, good. Submental and submandibular on both sides. From the frontal position. Good. The supraclavicular lymph nodes above the clavicles. Not enlarged and mobile. The axillary one. No enlargement noted, and the pectoral. Good. And over on this side, you can move your head towards your left. Preauricular, postauricular. Leg lymph nodes are not enlarged, and occipital and deep cervical in the back. Good. All right, now you can open your eyes, and we're going to do a test that's called sharp or dull. May I please have your palm? Sure. So I have here this device for doing sensory neurological testing. Okay. And this side is what I call dull, and this is sharp. So go ahead and keep your eyes closed. And I'm going to touch on your face, your chest, your arms. And I want you to tell me if you feel sharp or dull.
Okay.
All right. Good. Good.
Dull.
Good.
Dull. No.
Good.
Dull.
Good.
Dull.
Okay.
Sharp.
Mm-hmm.
Sharp.
Okay.
Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull.
Good.
Dull. Sharp. Dull. Sharp. Sharp. Sharp.
Good. Okay. Next up, I have here two devices that are quite cold, and I want you to keep your eyes closed and to tell me if you feel me touching you with one or two. So just say one or two.
Two.
Good.
One. Two. 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 One. One. Two. Two. One. One. Two.
Good. You got all of them right.
Okay, good.
All right. Next up, I'm going to touch you with something that's very, very soft. It is the softest object I have for testing neurological responses. So keep your eyes closed and just say yes if you feel it.
Yes.
Good.
Yes. 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 Yes.
No concerns.
Okay.
All right, next up, I have here something slightly sharper. It's not painful. May I have your palm? Is that okay?
It's okay.
All right. Keep your eyes closed and tell me if you feel one or two pinwheels.
Mm-hmm. One.
Good. I'm testing your response to the pain stimulus.
Two.
Good.
One.
Good. 1. Good. 2. 1. Good. 1. Good. Next up, I'm going to check your sensation to your ability to sense vibrations. So I have here a tuning fork, and when I strike it, it's going to create a vibration. And I'm going to place it at various points on your bony prominences. And I want you to try to localize it. So tell me where you're feeling it. Okay. With your eyes closed.
Shoulders.
Good.
Head.
Good.
Shoulder. Neck.
Just a bit.
Chin.
Good. And now I want you to tell me when you feel it stopping.
Stop.
Good.
Stop.
Good.
Stop.
Good. Very good. Right. Next up, I'm going to do a visual inspection of your arms. And I'm going to look for any signs I may have missed, any potential edema, not noting it. Okay, the inside. Normal color. No blues, purple. Good. Okay. May I please have you hold the palms up like this? I like to inspect them for red palm syndrome, palmar erythema, not noted. Okay, good. Going to check your nails too for any signs of clubbing, pitting. Capillary refills are normal. In between your fingers, I'm not noting any potential moles or melanomas. Good. Any pain here?
No.
All right. Oh, you're quite warm. I'm not seeing this very often. Usually everybody has cold palms. Okay. Good. Perfect. Let me just take a couple of notes, those observations. Right.
All good?
Oh, good, yes. Next up, I'm going to check your eyes. Good. And I'm going to begin by just testing for your pupil response. So go ahead and look straight for me. Good. And now look at the tip of my nose. Good. All right, I'm going to check for the consensual response. Good. Over on this side. Good. Excellent. All right. Next up, I'm going to take a peek at your optic nerve in your eye. And I'm going to use my ophthalmoscope for that. Are you wearing contacts right now?
No.
Do you usually wear glasses?
No glasses.
All right. Now you can just look into the distance and keep your eyes closed, opened. Gonna make sure that I can see you well. Good, perfect. And I'm going to come really close and inspect your macula, retina, and look just behind your eye.
Okay.
Okay. Good. No popped blood vessels. Optic nerve looks intact. Can you look right into my ophthalmoscope? Good. No signs of any macular degeneration. No scratches on your cornea. Gonna take a look over on the other one as well. Okay, you can look into the distance straight. Okay. Sclera is white on both of them. Normal optic nerve. Optic disc is well defined. Macula is intact. And now look into my ophthalmoscope. Perfect. Healthy eyes. Alright. I'm going to check for your vision acuity next. And I have here what's called the Snellen chart. Okay. And can you extend your arm? There we go. So right about here. Can you read me this line?
FPH.
Good. And I'll cover one eye. And read to me the bottommost line.
LTFPH.
Good. And now cover the other eye. And read to me the bottommost line from the last letter to the first.
HPFTL.
Good. And what color is this?
Red.
Red. Good. And this one?
Green.
Good. And now uncover both of your eyes. And can you tell me which circle is bigger, 8 or 9?
9.
Good. 20/20 vision.
Good.
All right. Next up, I'm going to look inside your ears and evaluate the state of your tympanic membrane.
Okay.
Have you ever had any tinnitus, abnormal sounds that you're hearing in your ears? Loud popping sounds that come out of nowhere?
No.
Oh, good. Okay. Move your head over towards your left side. And I'm taking a look at the auricle of the ear, behind the ear. No discharge, no inflammation. Do you feel this?
Yes.
And this? Good. Right, I'm going to take a peek inside. Normal tympanic membrane, pearly gray color, well-defined margins. Good. No signs of any infection or inflammation. A little bit of wax buildup, but that's normal. All right, I'm going to do the same over here. You feel this? And this?
Yes.
Good. Okay. normal tympanic membrane. No signs of a cerebral fluid buildup. Inner ear looks perfectly healthy. Okay, I'm going to put my otoscope back. And next up, I'm going to test your hearing. So close your eyes and tell me which side do you hear me making a sound, left or right?
Okay. Left.
Good.
Right. Right.
Good. And keep your eyes closed. Do you hear the sound coming towards you or away from you?
Towards. Away.
Okay. Can you point to the sound now?
Up.
Good.
Right.
Straight. Very good. Okay. Next up, I'm going to focus on your nose and your mouth. Have you had any discharge that's doesn't go away? Any infections of the nose? Sinus inflammation?
No.
No.
Never.
Okay. I'm going to begin by palpating your sinuses in your nose. Good. All right. Going to begin by feeling the frontal sinus. Okay. And the maxillary sinus. Good. I'm going to gently tap on the maxillary sinus. Any pain there?
No.
Any pain there? Good. The ethmoid and sphenoid sinuses towards the ears, not enlarged, no tenderness noted. Good. Okay, keep your eyes closed. And I'm going to give you something to smell, and I want you to try to identify the smell.
Coffee.
Good. And I'm going to obstruct one of your nares. Good. Can you smell this?
Barely.
Barely. So a little bit of a congestion over there. Let's try the other nair. Can you smell that?
Not really.
Okay, so your nose is a little bit stuffed. That's okay. You could smell the stronger coffee smell, so I'm not concerned. Let's check for the patency of your nares as well. Take a deep breath in and out. Good. And take a deep breath in and out. Good. I could hear you breathing. All right. Let's take a peek inside the back of your throat as well. Stick out your tongue and say ah. Okay, no signs of any infection or inflammation. Good teeth, healthy color of the tongue. Good, perfect. All right. So next up, I'd like you to lay down.
Okay.
Face up, so I can take a look at your tummy and inspect your abdominal area.
That.
Face here. Okay. Are you comfy? I'm going to begin by doing a visual inspection of your abdominal area. Is it okay if I lift your top? Sure. And is it okay if I lower your pants a little bit? Okay. going to look at the color of your abdomen and the skin. Going to check the temperature of your abdomen. Okay, normal temperature. Okay. No signs of any distension, no enlargement that is notable visually. Okay, I'm going to begin by doing a light palpation, and I'm going to check for the size of your internal organs. I'm going to be looking for any masses, trying to feel any lumps or bumps. So just relax. No masses are being felt. Okay. I'm going to assess the size of your liver. If you can lift your legs up a little so that the abdominal muscles are not in the way. Okay, let's see. Take a deep breath in and exhale out. Okay, I can feel the tip of the liver. No bumps. Good. Spleen is not enlarged. Good. Next up, I'm going to feel your cardiac pulse and attempt to feel the point of maximum impulse on the mid-clavicular line at the 5th intercostal space. So that's 1, 2, 3, 4, 5. Okay, that's normal. Okay. Pressing down on the kidneys. Take a deep breath in and out. Good. Not able to feel them. Alright. I'm going to auscultate the abdomen next. Okay. Continue breathing normally. I'm hearing a low-pitched gurgling sound, which is normal. activity is heard in all 4 quadrants. At the normal rate of 1, 2, about 3 sounds every 5 minutes. Okay. I'm going to check your aortic artery. Good. Take a deep breath in and out. Good. And I'm going to switch to the bell side for the more superficial sounds. Okay. Bowel movements are heard. Very good. All right, next up I'm going to do a percussion of your tummy and your chest. So go ahead and just relax. I'm looking for the resonance. Good. 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 No dullness and good level of resonance. I'm going to go ahead and use my medical hammer to tap on your rib cage and check the bone integrity. Okay, good. Good. And checking for the abdominal reaction. Good. Checking the elasticity of your skin. Do you feel this?
Yes.
That's dull. Do you feel this?
Mm-hmm.
That's sharp. Okay, go ahead and keep your eyes closed and tell me if you feel dull or sharp.
No.
Sharp. Sharp.
No.
Sharp. 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 Going to go ahead and move towards your legs and your feet next. Okay. Your legs have an even temperature. No excess swelling noted. I'm going to begin by palpating your calcaneus bone. Any pain right here?
No.
Good. And over on this other side. Good. Okay. I'm inspecting the plantar region of your feet. One mole is noted, less than 2 millimeters, one color, well-defined borders. I'm not concerned. Capillary refills within 2 seconds, which is normal. I'm going to inspect in between your toes. Good, you have a normal response. Can you wiggle your toes here? Good. And over here. Good. No moles, no hidden melanomas. Good. Can you wiggle your toes? Perfect. Okay. Alright, I'm going to pinch your calf muscle. Good neurological response. Over on your right foot as well. Just let your foot loose. Good, perfect. Alright, next up, I'm going to spray some water on one of your feet. Tell me if it's the left or the right one.
Okay. Left.
Good.
Right.
Good.
Left.
Good.
Right.
Good. I'm going to do some tapping and explore the bone integrity. I'm going to press down on your toes and I want you to try to wiggle the one that you feel a pressure on. And can you wiggle it now? Good. 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 And now I'm going to lift your toes up and down, and I want you to tell me if they go up or down. So this is up, this is down.
Up.
Good.
Down.
Good. And let's do the same test here.
Up. Down.
Good. And can you wiggle the toe you feel a pressure on? It's kind of hard to bring just this one up. Good. 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 Okay. Next up, I'm going to touch you with one or two cold objects, and I want you to say one or two. Good.
One.
Good.
One. Two.
Good.
Two.
Good. Okay. And I'm also going to touch you with something sharp and to say yes when you feel it.
Yes.
Good.
Yes. 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 Yes.
Okay. Can you put some pressure on your legs down? Good. I'm going to attempt to bring them together. Don't let me do that. Resist. Good. And I'm going to perform a circular motion. I want you to tell me if you feel any pain when I'm doing that.
No.
Good. Any pain here?
No.
Any pain here?
No.
Good. Painful here? Here? Here?
No.
Here? Good. Okay, you can come back up now so I can take a look at your back. Alright, Jamila, I'm going to take a look at your back next. Is it okay if I put your hair up in a ponytail?
Sure.
Okay. There we go. even temperature distribution. Just going to take a look at the moles on your back to see if I spot any of them that are abnormal. They're all one color, well-defined borders. Not seeing anything abnormal. The back has expected level of symmetry. I'm going to feel your spine next. Okay, spine is straight. I'm going to do some tapping on the spine to check for any abnormal reactions. And I want you to let me know if you feel anything that's a sharp shooting pain, any zapping. Okay, good. I'm also going to percuss the spine. Good. Not hearing any hyper resonance. Right. Next up, I'm going to slide this tuning fork down your spine very slowly, and I want you to tell me if you feel any abnormal reactions. Okay, unexpected level of sensitivity is noted. Good. Okay. Shoulders are even. I'm going to check the scapulas in the back. Good. Good. All right, I'm also going to listen to your lungs. Take a deep breath in and out. Deep breath in and out. Okay, can continue breathing normally. Okay, can you whisper 1, 2, 3 now?
1, 2, 3.
Again.
1, 2, 3.
Good. I'm not able to hear the whisper through the stethoscope, so that's normal. All right. Can turn around now. All right, Jamila. How do you feel so far?
Good.
All good? All right.
Very relaxed.
I'm happy for that. Next up, I'm going to check your reflexes, and I'm going to use my medical hammer for that. And I'm going to tap on your elbows, your wrists, your knees, and your ankles.
Okay.
Let's start with this arm. And if you can lift it just like that now, leave the weight on my hand. Okay, good. Let's try again. Try to move it like that. Good, perfect. And let's try over on this side as well. Okay, give me all the weight. Good, perfect. And leave all your hand weight on my hand. Good. Same with this one. Yep. Give me all the weight. Good. Perfect. And your knees. Okay, that's one. Perfect. All right, Jamila, this concludes the assessment for today. I did a very thorough neurological assessment of your whole body, and there is some sensitivity that you have, especially on your feet. Nothing too concerning, but I do want us to monitor it, so I recommend that you come back in a few weeks.
Sure. Thank you so much.
May I please have your first name?
My name is Elif.
Alif. Very nice meeting you, Alif.
Nice meeting you too.
And what is your date of birth?
It's October 7, 1997.
1997. Okay. Do you have any particular concerns related to your health?
Not really, just wetness in my ears
Little wetness in your ears. Okay.
and itchy eyes in the morning.
Itchy eyes. Most and definitely check those out. And when did these two symptoms begin, Alif?
A few weeks ago,
Okay. On a scale of 1 to 10, how much do these symptoms bother you?
I would say 7.
A 7. Okay. Do you have any other symptoms other than the wetness in the ears and the itchy eyes?
No,
No? Okay. No other, no pain anywhere in your body? Any tingling sensations associated with these two symptoms?
not really. Only those two.
Okay. Are you on any medication right now?
I've been trying to take some, but it doesn't seem to help.
Okay. So you're suspecting this could be obviously a mild case of allergies?
Maybe. We'll find out.
And what is the medication that you're in? Do you know the name?
I don't really remember it. I can show it after.
Okay, sounds good. It's probably an over-the-counter medication,
yeah.
right?
Yes.
Okay, so not a prescription strength.
No.
Sounds good, Elif. Do you happen to know your weight and your height?
My height is 5'6", and my weight is 119.
119. And when was the last time that you were sick with the flu or the common cold or anything?
I would say a year.
More than a year ago?
It's been quite some time.
Oh, well, you're pretty healthy then. Yeah, so definitely because we are in the spring season and we live in an area where there's a lot of pollen. The two symptoms that you mentioned could be associated with that. I'm also suffering from allergy myself, and I do get the same thing in my ears and my eyes. But we'll go ahead and give you a full checkup to make sure that there's nothing else underlying that could be the reason.
Sure. Thank you.
All right. And when is the last time that you had blood tests done?
3 to 4 months ago.
3 to 4 months, okay. And do you know if those were all normal?
Totally fine.
That's very good news. Okay, I'm gonna send in a request to get a copy of those from your previous doctor. And I see that we have your insurance on file. Associated with your ear, have you ever had any tinnitus, any ringing in your ear, any unexplained sounds or noises that you hear?
No.
No, that's good. Okay. And any history of blurred vision or double vision for your eyes?
No.
Nothing, that's good. Okay. Sounds good. So I do have your medication here, your history. All right. I'm gonna go ahead and put this down for now. And I'll sanitize my hands. And I'm going to begin just by taking your vital signs and making a note of those, and then I'll focus on your head, your arms, your torso, your legs, and your feet,
Sure.
as well as your tummy.
Okay.
Sounds good. Okay, I'm gonna start off by just taking your temperature. Behind the ear, 98.4, so you don't appear to be feverish.
That's good.
Yeah. I'm going to check the levels of oxygenation in your blood. May I please have your index finger? And just relax. 5, 4, 3, 2, 1. Okay, we should be getting a reading just about now. Okay, so I'm seeing 99% oxygenation and a good steady rhythm for your heart of 80 beats per minute, so quite normal. Okay, I'm gonna set this down. And I'm going to use my stethoscope to just do a very basic check of your heart and your lungs, and I'll be looking for any abnormal sounds, any bruits, anything that may indicate something abnormal with those organs. Okay. I'm gonna go ahead and sanitize it first. So it is a little bit cold. Is it okay if I slide this in right here?
Of course.
Okay. Just breathe normally. Okay. So I'm hearing a normal rhythm. I'm hearing S1 and S2, not hearing S3 and S4, so no extra sound. Take a deep breath in and out. Deep breath in and out. Good. No crackling or swooshing. Lungs are normal as well. Okay. Let me just take a note of these observations. So normal temperature. S1 and S2, no S3 and S4 could be heard. Normal, steady heart rhythm. Blood oxygenation was within normal limits. Okay. Very good. I'm going to go ahead and check your pulse as well manually. I'm going to do it in 3 different locations. At your wrist, your brachial artery, as well as your carotid artery. So I'm going to start off with your wrist. You can just breathe normally and relax. Okay, that's good. I'm able to feel your pulse about 85, 86 beats per minute. Okay, that's good. Your brachial artery. I'm going to be looking at the character of the pulse. We want a normal character, not hyperdynamic, not weak or thready. Okay, that's good. Excellent. And over your carotid artery. Good. Normal pulse. Alright, next up I'm going to put my gloves on. And I'll start by just doing a general inspection of your face, your scalp, your skin on your arms. And we'll take it from there. Okay. Gonna look at your face and explore your face and look for any lesions, any moles, any scars, and see how your face area looks like. Okay. No dryness, not noting any redness. Skin is reactive to my touch. Good elasticity. No moles. And you can just close your eyes and just continue breathing normally. Okay, I'm just going to touch the skin lightly and see the response. Okay. Okay, one more here. Well-defined margins, one color, not concerned about it. I see that your eyebrows are full, hair distribution looks normal, eyelashes as well, the mouth is symmetric, a couple of small moles on your face. Same observations, one color, well-defined margins. Couple of other moles on your neck, less than 2 to 4 millimeters. No discharge on the outside of the ear or comb. I'm gonna take a look over on this side as well. Okay, that looks quite normal. I'm going to go ahead and perform a light tapping of your jaw bones and your cranial area, the face. I want you to let me know if you feel any pressure that's out of the normally, any sharp shooting pain, anything that's discomforting you. Okay. It should be quite a pleasant sensation.
It is.
I'm listening for the resonant sounds of your skull and checking for overall bone integrity. Okay. And over on your jaw. Okay, that's good. I like those sounds. I'm going to do a little bit of a deeper percussion with my fingers next.
Sure.
Okay. And if you can open your mouth just a little bit, yes, perfect. And over on this side. Good, perfect. I'm gonna go ahead and feel your head next. Have you had any trauma to the head ever?
No.
No trauma. Good. Any pain, any migraines, anything that's bothering you?
Not really.
Okay. I'm gonna go ahead and just press a little bit on your skull and apply some pressure. Okay, good. Touching your mastoid bone process behind your ear. Good. And over on the other side. Okay, good. I'm gonna feel for any lumps or bumps next from the back. head is symmetric. Not feeling any lumps, any bumps. Okay, that's very good. Good. All right, I'm going to check your lymph nodes next. Ooh, I electrified your hair. Okay, so I'm gonna go ahead and press on your lymph nodes over on this side. I'm gonna start in the front with the pre-auricular lymph node. Good. Not swollen, a little bit mobile. Good. Okay. The posterior auricular in the back. Not enlarged. Occipital. Not enlarged. Superficial cervical. Deep cervical. And posterior cervical. Good. Okay. Tonsillar. Submental. Okay. Yeah, I can feel it. And submandibular. Good. The front side. Tonsillar. The back. They're all mobile and not enlarged. Okay, I'm also going to feel your axillary lymph nodes right here. So just relax, making sure it's mobile. Yep, and your pectoral right here. Okay. Good. Over on this side as well. Okay. Axillary and pectoral. Okay, that's good. And just feeling the neck lymph nodes from this position as well. Occipital and the cervical lymph nodes. Okay. And the supraclavicular ones right here above the clavicle. Perfect. Okay, very good. Alright, I'm gonna go ahead and just look at the skin on your arm. Just making sure I'm not missing anything, any redness or swelling. No signs of edema. And over on the inside of the arm as well. Okay, good. Alright, you can place this one down. I'm gonna take a look over here. Good. And over on the inside. Okay. No lesions, no scarring. Just gonna feel for any signs of edema or any inflammation, any swelling. Good. I'm going to go ahead and apply a little bit of pressure on your paranasal sinuses. I want you to tell me if that's discomforting you in any way.
Oh.
Okay. So starting with the frontal sinuses. Okay. They don't seem to be enlarged. That's good. I'm gonna go ahead and tap. And over here too. And right there. Okay, good. And right here, the maxillary sinuses. Okay, a little bit of a congestion right here. I'm able to feel it with my hand. I'm gonna go ahead and do a test that's called a trans-elimination test. I'm gonna shine a light on the sinus right here, and I want you to open your mouth. I want to see if I can. Okay, yeah, it's a little bit congested. Let's check this one. You can open your mouth. Okay. Okay. Yeah. I'm getting a little bit of translucent glow, but not much. Yeah, I do seem to have a little bit of a congestion right here. Probably due to allergies. That's what I'm suspecting as of right now, but we'll go ahead and do an inspection of your eyes and ears as well. Did you feel any pain when I was touching you?
No, not really.
Okay, good. So I'm going to focus on your eyes next. And I'm going to check for the pupillary response. I want you to just look straight. And I'm gonna shine my light in your eye. Gonna try to isolate one of them. Okay, that's good. Yes. Right pupil is accommodating. Right, let's see this other eye. Yeah, left pupil is accommodating as well. And I'm going to check for the consensual response as well, not just a direct one, which is what I just did. So I'm gonna do this and then check the other. Okay, good. Strong light. Oh, good. Sorry, just one more. It's okay. Okay, good. So both direct and consensual responses are accommodating. Your pupils are round and reactive. They respond synchronized, which is very important. So let's check your peripheral vision as well.
Sure.
So I want you to look at the tip of my pen, and I want you to just not use your head, only use your eyes and follow this. Okay, can you tell me how many fingers I'm holding up here? 2, very good. Continue looking right here. And how about now, how many fingers am I holding up?
1.
1 finger, perfect. Right now I want to check the mobility of your eyes. So peripheral vision is okay. Now let's check mobility. So continue looking right here. I'm gonna bring it closer. I'm gonna move the pen in all 4 quadrants of the vision field. And I want you to look in the distance at the wall, and now the pen again. Perfect. Great, so good mobility, binocular vision is intact, peripheral vision, the field is okay. That's good. I'm gonna go ahead and look in the back of your eye next at the retina and the macula, and see if I can detect any abnormalities such as macular degeneration or anything that has to do with the retina of the eye. Okay. I'm going to use my ophthalmoscope for this. And I'm going to have to shine another light in your eyes. I'm really sorry. I'm going to just first make sure that it's nice and clear. Okay, I can see you quite clearly. Perfect. So now I want you to look in the distance for me. And okay, let's see. Perfect. Okay. All right. Okay. I'm able to see the optic nerve and the optic disc. Macula is well defined. No white spots. Optic nerve is intact on this side. I want you to look up for me. I'm going to take a look at the conjunctiva, which is pink and moist. Good. And the sclera is white. I'm not seeing any popped blood vessels. The eyeball is not bulging. Okay, very good. I'm going to check the other one as well. Just making sure that I can see you clearly with it. Okay. Perfect. So continue looking in the distance for me. Just calibrating my ophthalmoscope. Okay, perfect. I'm gonna come really close. Okay. Optic disc is intact. No popped blood vessels. Can you look into my ophthalmoscope right now? Perfect. Macula is well defined. Not seeing any signs of macular degeneration or any abnormalities of the retina. That's good. Yes, very good. All right. I'm gonna go ahead and test your visual acuity. Do you usually wear glasses or contacts?
I do not.
No. Okay, good. So this is called the Snellen chart, and I'm going to ask you to read this last line for me. And I want you to cover one eye for this.
L T F P H.
Perfect. Okay. Now cover the other eye, and I want you to read the same line but backwards.
H P F T L.
Very good. So have 20/20 vision in your eyes.
Nice.
I'm gonna go ahead and take a couple of notes of these observations. So eye exam checks out no positive findings, no signs of macular degeneration. Sclera and conjunctiva looked good. Optic nerve intact. We saw sinuses earlier, mobile and not enlarged. Lymph nodes checked out. Okay. Very good. So I'm going to focus on your ears next. You mentioned you've not heard any sounds or any tinnitus or anything. Any discharge that's not clear, that's a little bit, yellowish or any other colors?
Oh, not that I noticed.
No, okay. And the itchiness, does it happen more during some time of the day for your eyes? And the wetness in your ears, did the symptoms appear more in the morning or in the night?
It usually appears more in the morning.
More in the morning.
Mm.
Okay. And no pain associated with any of them?
No pain.
And have you noticed both of your ears and eyes affected in an equal amount? Or one more so than the other?
Well, I believe sometimes my right ear
Your
is
right ear?
affected more than the left one. Yeah.
Oh, okay. Right ear, let me just make a note of that. That may be important going forward. Okay, so right ear. Good. Alright. I'm gonna go ahead and inspect your ears. Just taking a look in my otoscope on the outside of the ear auricle. Any pain when I pull up?
No.
How about when I pull down?
No.
Good. And laterally?
Mm-mm.
Okay. I'm going to go ahead and check the tympanic membrane, the ear canal next. Okay, you have quite a small ear canal. Okay. I'm looking for any discharge, any sign of an infection. I'm seeing a little bit of redness on the ear canal. That's mostly on the outside. Your inner ear looks okay, but let me just take a look at the tympanic membrane. Be able to visualize it. Okay. Pearly gray color, not inflamed. So your inner ear looks okay. It's mostly just the canal that's a little bit red. Okay. Let me take a look here as well. Normal ear auricle. No discharge. A little bit of wax buildup. That's quite normal though. Yeah. Same observation. A little bit of a redness and wetness on the canal, but mostly towards the exterior, which is consistent with the allergy diagnosis that we're working with as of right now. I'm going to test your hearing next. Okay. I want you to close your eyes, and I'm going to make a sound, want you to try to point to where the sound is coming from.
Okay.
Good. 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 So no concerns there.
I can hear.
Yes. I'm also checking the cranial nerves as we go through these tests. The cranial nerves are 12 nerves that go all the way from your brain throughout your body, and they control various mechanisms of your body, such as your sight, your hearing, your sense of touch, your smell, your taste, so all of your senses. Okay, I'm going to focus on your nose next. I'm going to just begin by doing just a light palpation. Okay. I'm not feeling any lumps or bumps. Do you feel any pain when I do this? How about when I do this? Good. Take a deep breath in and out. Deep breath in and out. Okay. So one of your nerves is not as patent as I want it to be. You have a little bit of a congestion right here. Yeah. Okay. I'm gonna go ahead and look inside your nose as well.
Oh my god, I'm sorry for whatever is in there.
Oh no, it's fine. No worries. Okay. The right one that was patent looks okay. No discharge. And let's see the left one that was a little bit stuffed. A little bit of a redness, but no discharge, which is good. Okay, I'm going to test your sense of smell next. So I want you to tell me if you can smell this and what this is.
It is like a medicine. Rosemary?
Rosemary, good. Okay, now I'm going to give you something to taste. Let's see if you can taste properly. Good, stick out your tongue. What does that taste like?
Vanilla?
Vanilla, good. Alright, so you can taste and you can smell. We got those two down. I'm going to look in the back of your throat and see if there's any inflammation, if I can spot your thyroid gland, which I should not be able to, and whether you have any infections going on that we should treat. So go ahead and stick out your tongue for me. Say ah. Okay. Yeah. Not seeing any redness. Couldn't spot your thyroid, which is good. Also going to go ahead and palpate your thyroid since we're here. It should be fairly palpable and not enlarged. Good. Can you swallow for me? Mobile. Good. I'm going to try to feel it from the back as well. Alright, go ahead and swallow for me. Perfect. So your thyroid gland is not enlarged and no signs of any concern. Alright, good. Next up, I would like you to lay down and I'm going to auscultate your tummy and palpate, percuss, and explore a little bit your internal organs, check their size, and see if there's any concern there.
Okay, of course.
Right, Elif. I'm going to begin by doing a light palpation of your tummy. Is it okay if I lift up your shirt a little bit?
Sure.
Okay. And is it okay if I also pull down your pants? All right. So just go ahead and breathe normally. I'm going to attempt to feel your major internal organs, starting with your liver, your stomach, your spleen, your kidneys, and feel for any masses, lumps, bumps, anything that shouldn't be there. Okay. Not feeling any masses. I'm going to check the size of your liver, and I want you to help me by taking a deep breath in and then exhale out. Okay. I want to feel the tip of the liver right there. Good, perfect. Quite smooth. And feeling your spleen. Have you ever had any problems with your spleen?
No.
No, good. And I'm also going to feel your kidneys. Go ahead and take a deep breath in and exhale out, applying pressure. Okay, good, not enlarged. Okay, I'm gonna go ahead and auscultate the area. Listening to the renal arteries. Activity can be heard in all four quadrants. No swooshing sounds. A little bit of gurgling, consistent with a normal abdominal activity. Okay. All good sounds from your abdominal cavity. I'm gonna go ahead and lay this down. I'm going to go ahead and check your dermatomes. So how well you feel sensations on your skin. I'm going to touch you with the fluffy side. Do you feel this?
Mm-hmm.
And I also have a sharp side. Do you feel this?
Yes.
Good. I want you to tell me if it's sharp or fluffy or dull.
Okay.
Good.
Sharp.
Good.
Fluffy.
Good.
Sharp. Sharp. Sharp.
Good. Okay. And do you feel this equally on both sides of your tummy?
Yes.
How about now?
Yes.
Good. gonna go ahead and do a light percussion of your abdominal area. I'll be listening for the resonant sound, and I'm particularly paying attention to any potential dullness, anything that's not a resonant sound that I expect. Okay, that's good. 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 A little bit of a dullness there. Okay. That's good. So I'm hearing excellent resonant sound over here. This area is a little bit dull. Did you happen to have a bowel movement today? Could explain the dullness over here if you can't remember. I'm gonna just test one more time. Okay, just a little bit of a dullness. Yeah. I don't remember anything, but maybe. Good. That's quite normal. All right. I want you to go ahead and lift up your knees a little bit now. Good. Gonna go in with a little bit of a deeper palpation over in your lower abdominal area. Okay. Okay. Good. I'm also going to check your skin elasticity. Normal elasticity. Very good. Okay, I'm gonna focus on your feet and your legs next. Have you noticed any pain in your legs or your feet?
No.
Do you usually wear high heels a lot?
Well, when I wear high heels, I do have some pain, but I think it's normal.
Okay. It goes away after you stop wearing
Yes,
them.
it does.
Good. Any excess sweating of your legs or any coldness or irregular body temperature?
No.
Okay. Is it okay if I remove your socks?
Of course.
Okay. So, oh, your foot is quite cold.
Maybe it's because of the AC.
All right. A little bit of coldness here. Not cold up on top. Okay. I'm gonna check your capillary refills. 2 seconds. Seconds, quite normal. I'm gonna check your orbital pulse. 2+, synchronized. I'm gonna check it in the back of the ankle, the tibial pulse. Normal. no skin lesions or scars. I'm able to see some blood vessels. A little bit. They look normal. You are fairly skinned, so this is quite normal to see your blue and green vessels. Okay, I'm going to attempt to bring your fingers towards your head. Don't let me do that. Push back into my arm. Good. Now I'm going to attempt to bring them towards me. Don't let me do that. Good. I'm going to attempt to spread your legs apart. Don't let me do that. Don't let me do that. Good. And I'm going to attempt to bring them together. Resist that. Good. Okay. I'm going to check your plantar region over on the sole of your foot. And I'll be feeling for any pain or tenderness that's associated with that area. So I'm going to do quite a deep palpation.
Okay.
To let me know if you feel tenderness, discomfort.
That's actually nice.
It's nice, good. Okay, so plantar region is normal on your left foot. Let's check the right. No lumps. No bruising. Okay, that's good. Okay, go ahead and check in between your toes for any hidden melanomas, for example, any abnormalities of the skin that can be very easily missed in a more routine checkup than this. Good. Nails are not clubbing or pitted. That's good. No abnormal moles. Okay. Your nails look healthy, no clubbing or pitting. I'm gonna go ahead and tap on your bones in your legs. Check for integrity, pain. Good. Good. If you can lift up your foot just like that. I'm going to tap over on the plantar region as well. Okay. That looks quite normal. Good. Okay. I'm gonna go ahead and do the same over here. Very good. Next up, I'm going to test the sensitivity in your skin, your legs, and the nerves associated with the sensations in your feet and your legs. Do you feel this? Mm-hmm. Good. How about this? Yes. Okay. Do you feel this equally on both of your legs?
Yeah.
Good. Equally on both of your legs?
Mm-hmm.
Good. Equally on both of your legs?
Yeah.
Equally. Good. Now I want you to close your eyes and tell me if this is sharp or dull.
Sharp.
Good.
Sharp. Dull. Sharp. Dull.
Good. And I'm going to be touching you with something a little bit more sharp. And I want you to keep your eyes closed and say yes when you feel it.
Yeah. Yes. Yeah. Mm-hmm. Yes. Yes.
Good. Alright, Elif. You can come back up. Right, Elif. Next up, I'd like to check your dermatomes. So the dermatomes are what control the sensations in your skin, and I want to make sure that those work okay across the body, across your face, your chest, and your arms. So I'm going to be using these two devices, and we've done the test before. Do you feel this?
Yes.
And yeah, this is dull and this is sharp. And I want you to keep your eyes closed and tell me if you feel sharp or dull.
Okay. Dull.
Good.
Sharp.
Good.
Dull. Sharp. Dull. 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 Dull.
Good.
Sharp. Sharp. Dull. Sharp. Dull.
Good. Now, do you feel this equally on both sides of your forehead?
Mm-hmm.
Equally on both sides of your arms?
Yes.
And equally on both sides of your chest?
Yeah.
And your hands?
Mm-hmm.
And the back of your arms?
Yes.
Good. Shoulder in the back?
Yeah.
Feeling this equally?
Yeah.
And feeling this equally?
Yeah.
Good, perfect. All right. Next up, I'm going to check your myotones. And the myotones are a group of muscles in your body that are controlled by the same spinal nerve. So I'm going to be placing my hands on you and ask you to resist against them.
Okay.
So try to push into my arm with your head. Good, perfect. And over on this side. Good. And I'm going to attempt to push your head back. So resist. Good. And going to attempt to push it forward. Resist. Perfect. You have strong muscles. Good. I'm going to take your arm and attempt to bring it back. Don't let me do that. Good. And going to attempt to push your wrist up. Don't let me do that.
Mm-hmm.
Good. So that looks okay. So don't let me bring your arm back. Good. Don't let me bring your wrist up. Perfect. Okay. And now I'm going to attempt to just push you by your shoulders back. Resist. Good. Bring you back. Resist. Perfect. All right. And finally, I'm going to check your reflexes. I'm going to take this arm. You can just let it loose. Okay. Good. Perfect. That's all right. And just let it loose. Perfect. Okay. And over on your wrist, you can just let it loose in my arm. Good. And I'm not gonna hit your watch. Good. All right. And over on your knees. Okay, right about here. Make sure your legs are just relaxed. Good. And the other one. Perfect. All right. All right, Lymph. This concludes the assessment for today. I find you to be perfectly healthy, no red flags, no signs of any concern. I believe that you may be suffering from a mild case of allergies, so continue taking the medication. I can prescribe you something more strong, and you can give that a try as well and see if you can relieve the stuffy nose a little bit. Do you have any questions for me?
No, I don't. Thank you so much for your help.
All right, I hope to see you again soon then.
Hope to see you soon. Bye-bye.
Welcome back, Juliana.
Thank you.
So I heard that you had an accident and something is going on with your knee.
Yeah, I was longboarding and I fell. And I fell onto my knees and also kind of sprained my ankle. And I also fell on top of the longboards, like here. Okay. So here also I have pain. And then down my knees and foot.
Okay, so left knee and foot and the left side of your abdomen.
Yes.
Okay. How long ago did this happen?
A week ago.
1 week. Did you hit your head when you fell?
No.
On a scale of 1 to 10, how intense was the pain right after the fall?
Right after was like 5.
Okay.
Right now I would say is a 3 or 4. When I exercise, it's worse.
Okay. And the longboard, you said that it hit you right here.
Yeah.
Okay,
I fell onto it.
Was there any penetration of the skin or?
No.
Okay. I'm not able to see a bruise, but it does feel like the area here is very swollen a little bit.
Mm-hmm. And it's very tender when you press it.
Okay, let me just compare with this side. So it's definitely hard here. And a little softer here. So you might have an internal bruising. Okay. Any pain when I press down?
A little bit.
Okay. Are you on any new medication?
No.
Did you lose consciousness when you fell?
No.
That's good. Any other symptoms with your eyes, your ears? Oh,
No.
okay, good.
And I've taken like a muscle relaxant to help with the pain to sleep.
That's good. And did it help?
Yes.
Did you take anything last night before you came in to see me?
No.
No. Good. So no ibuprofen or Tylenol, nothing for the pain. Good, so I should be able to observe exactly what's going on without interference from any other medication. Good. Any flu-like symptoms?
No.
Okay. Are you able to elevate your leg at all? Okay, that's good.
It hurts a little bit.
So, restricted mobility. Okay. Can you uncross them and cross the other leg over? Okay, now can you go back? Okay, that's good. Let me go ahead and put my gloves on. And I'll begin by doing a visual inspection of your abdomen and your knee from this position. And how long ago did you get the tattoo?
Probably 10 years.
Yeah, it looks like it healed just perfectly. Okay. So let me just go ahead and take a look first. Okay, I'm feeling for any inflammation first. And I am able to see a couple of scars here, but they look pretty old, right? Okay. Let's see. Any pain here?
A little bit.
Okay. So let me go ahead and check for any crepitus. And we're going to go up one time and then down. Okay. Down. Okay, good. I'm not able to hear any clicking sounds or anything that might indicate an actual tear of the meniscus. Not seeing any bruising or any rashes or irritation on the skin. Okay, I'm gonna go ahead and tap very lightly on the kneecap right here and around it, and I want you to tell me if you feel pain.
Yes.
Okay, right here?
Yes.
Okay. On a scale of 1 to 10, how intense was that?
4.
A 4. How about right here?
Yes.
And here?
No.
Okay, so right here.
Yes.
Okay, let me go ahead and take a look at your abdomen too. Any pain there?
No. No.
How about here?
Yes.
Okay, you can come back up now. Yeah, I understand. So you have pain right here, and then right under the meniscus, more so on the median zone than the lateral one. Okay, let me just quickly listen to your heart and lungs to make sure that I'm not missing anything obvious. Okay, just go ahead and breathe normally. I'm able to hear S1 and S2, not hearing any extra sounds. Okay, take a deep breath in and out. Good, I'm just assessing your lungs now. Good, you can breathe normally. Okay, going to check your aortic pulse. Good. And I'm going to check for any bruit around your carotid artery. Good. And I'm going to take your pulse manually. Good. Gonna check your brachial pulse and radial. Okay, very well. Can you squeeze my hand? Good. Can you bend forward? Good, and then bend back. Perfect. Can you go like this? Okay. Does this hurt right here?
A little bit.
Okay. You can lower your arm. Okay. So lungs and heart exam was a pass. No bruits were heard. Abdomen is swollen and slightly distended on the lower left side. Okay. No obvious breakage of the meniscus. Okay. Can you keep your eyes closed and let me know when you stop feeling a touch?
Stop.
Okay.
Stop. Stop. Stop.
Okay. And
Stop.
good.
Stop. 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 Stop.
Good. Okay. checking the proportions. 34. 30. Okay. That is symmetric. You feel a little warm to the touch. Have you noticed a fever in the last couple of days? No. Okay, let me go ahead and check your temperature. 98.9. That's good. And may I please have your index finger? Okay, let's leave that for a second. So no fever, and upper body dermatomes are intact. Abdominal dermatomes are intact. 99% oxygenation and 80 beats per minute. That is within normal parameters. Okay, let's go ahead and lay down and I'll take a closer look at your abdomen and your knee. Okay. Okay, let's do a couple of range of motion so that I can understand exactly the extent of the damage here. Can you elevate this leg? Okay, now lower it. Now can you do it on your own? Okay. And how about the left arm? Okay. And any pain right there?
No.
How about here?
A little bit.
Okay. Let me go ahead and focus on the abdomen first. Is it okay if I elevate your top and lower your pants?
Yes.
Okay. I'm gonna go ahead and palpate the area. Checking for symmetry around your abdominal cavity. And checking for any masses. Okay, can you elevate this foot a little bit? And yes, you can, like that, and just rest it there. Good. So that the muscles are not tightened. Okay, good. I'm not able to feel anything abnormal. I'm gonna go ahead and clean the area. Okay, I'm going to check the dermatomes on your abdomen. I caused a vibration. Go ahead and tell me when you stop feeling it.
Stop.
Okay, good.
Stop. 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 Stop.
Good. Go ahead and tell me if you feel this on the left side of your abdomen or the right one.
Left. Right. Left. 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 Right.
Okay, good. And now I'm going to touch you with 1 or 2 prongs. Go ahead and say 1 or 2.
2. 1. 2. 1. 1. 2.
Good. Now I'm going to touch you with something sharp or dull.
Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Next up, it's going to be something wet or cold.
Wet. Cold. Cold. Wet. Cold. 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 Wet. Wet. Wet.
Okay. You have a slight elevation of the skin on the left side. The elasticity and the pinch test. Okay. Okay. Checking the right foot for any signs of edema. As well as the left. The left kneecap is definitely more swollen. Comparing it to the right one. A little bit of an inflammation right here. And checking the tibia bone. Okay. Okay, can you tell me if you feel a sensation on your right foot or the left one? Left. Good. Right. Good. Now can you tell me when you stop feeling it? Stopped. Good. Stopped. Stopped. Good. Stopped. Okay. Can you push with your pads into my hand? Perfect. I'm gonna do an inspection of your toes. Okay. No signs of clubbing or pinning on the right foot. Gonna check the left one. These toes are a little more reddish than these ones. Yeah, I think you have a slight inflammation going on with your toes. Okay. Going to feel the plantar region. Okay. Right foot is normal. Any pain there? No. Okay. Can you bring your big toe toward your head? Perfect. Now try again. Perfect. And now point towards me. Okay, reduce mobility on this one. Okay. Can you tell me if you feel me touching you on your right foot or your left?
Left.
Okay.
Right.
Okay. Now I want you to flip face down so I can take a look at your calves and your ankles. I'm going to palpate your calves. No signs of any edema. And measure your ankles. Okay. They are very symmetric, so I'm not feeling any swellness or seeing any asymmetry with your calves. Okay, can you tell me if this is sharp or dull?
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, good. Good, no nodules behind the skin. And no abnormal reactions with the bottom plantar region. Okay, am I touching you on your left or right foot?
Left.
Good.
Right. Left. Right. Right. Left.
Good. Okay. Can you curl your toes around my fingers? Okay. Let's try from this position. Perfect. And now squeeze as hard as you can. Good. And now let's try the right foot as well. Perfect. Okay. Going to do the Babinski test. Good. Perfect. So now positive findings. You can go ahead and stand up and we can discuss the result. Okay, Juliana, so I did a very thorough investigation. The good news is that there's nothing neurologically wrong with you. Most likely you just bruised your kneecap and your foot, and the paddle board that kind of pierced you right here created a bruise internally in the abdominal cavity, but that should subside within the next couple of days. So
Okay.
if you don't start feeling any better, then come back and see me.
Okay, thank you so much.
You're welcome. Welcome back, Rita.
Hi.
My name is Dr. Lula and I'll be doing your medical checkup today. May I please verify your date of birth?
My date of birth is August 20th, 2002.
All right. And when was your last checkup?
It was almost a year ago.
Were there any abnormal findings during that procedure?
Yeah. I was diagnosed with arrhythmia,
Okay.
and I've been also feeling palpitations.
Heart palpitations?
Yeah.
Okay. How long have you had them for?
I've had them for a few months now.
All right. Are you on any medication for that?
I take a beta blocker.
Anything else? Any other medication?
No.
Okay. In addition to the heart palpitations, do you feel any dizziness or any headaches?
I have been feeling a lot of dizziness.
Okay. And how often do you feel that?
Every other day.
How bad is it on a scale of 1 to 10?
I would say 8.
Okay, so that means you have to stop what you're doing and lay down.
Yeah.
Okay. So it's probably preventing you from going about your day to day. Any shortness of breath?
No.
Okay. Have you noticed the heart palpitations and the dizziness getting better or worse over time?
I think it's kind of stayed the same over time.
Okay. Any chest pain or discomfort?
A little bit.
Okay. Can you show me where you feel that?
I'd say like over here.
Right there? Okay. Does it radiate anywhere else in your body or? Okay, so it stays localized.
Yeah.
Got it. Have you had any fainting? Any episodes of syncope?
No.
So no losing consciousness during the dizziness?
No.
Okay. And how's your energy level overall? Do you feel tired often?
I do actually feel tired often.
Okay. And do you feel like you get enough sleep at night?
I actually do get enough sleep.
How many hours would you say you usually sleep for?
Say 7 to 8.
That should be enough to go about your day without feeling tired.
Yeah.
Any troubles with your ears and hearing?
No.
All right, Rita, let's go ahead and begin your annual checkup, and I'll focus on the cardiovascular system today, as well as your back, your legs, and your feet. Okay, I'm gonna set this aside and put on the medical gloves. And I'll start off by taking your vital signs. Are you feeling dizzy right now?
I think I'm okay right now.
And how about the chest pain? Do you feel it?
It's pretty normal right now.
That's good. That means we're going to get a pretty good baseline for you. So I'm going to take your temperature first. This is going to go over your forehead and behind the ear. 98.2. So you do not have a fever. I'm going to check your heart rate as well as your oxygenation. The index finger right there. Okay. You can just keep this here. And I'm just going to feel your pulse on your neck. Is it okay if I touch you on your neck? Okay, good. That feels normal. So carotid is normal. I'm also going to check your pulse brachially. Good. And your heart rate is 100 and 99% oxygenation, so that is all good. I'm just going to make a note of that. So temperature was normal, heart rate and oxygenation within normal parameters. I'm going to go ahead and listen to your heart and lungs. Okay, you can go ahead and relax. And this may be a little cold, so I apologize about that. Okay, just breathe normally. Not able to hear any murmurs. Good. Take a deep breath in. I'm going to assess your lungs. And out. Okay, deep breath in. And out. You can breathe normally now. Good. So heart and lungs sound okay. I'm just going to observe you physically first. So go ahead and just relax. I'm looking for any abnormalities that are physically present that would indicate anything that we should further investigate. So looking at your neck and the chest. And on the inside of your arm. Okay, that's normal. No obvious abnormalities of the skin. I'm gonna go ahead and palpate your arms first, but before that, I'd like to assess if you have tremors. So go ahead and elevate your arms like that. Good. And let me just observe them. You can close your eyes, and I want to see if you're able to keep them at the same level. 1, 2, 3, 4, 5. Good. No tremor is present. I'm going to go ahead and palpate and check for any signs of edema or any pain that is more than usual. Can you move your head left to right? Perfect, and then back. Okay, and forward. And then back. Perfect. Okay, I'm gonna go ahead and check your blood pressure. Have you had this done before? Okay, is this arm okay?
Yeah.
Wonderful. So let's go ahead and match this over the artery. Alright. Go ahead and just relax. Right, very well. You can just slide this. So blood pressure was a little elevated. Have you noticed before that your blood pressure is elevated? 130/85. Or is this the first time you were told?
This is the first time.
Okay. Right. You may want to consider maybe cutting down a little bit of the salt in your diet. That should help lower the blood pressure.
Okay.
All right. Next up, I'm going to check your reflexes. So I like to close your eyes, and I'm just going to tap on some bony prominences of your body and check the neurological response. I'm going to start at the top of the head here. Okay, good. Good eye reflex. Good. Can you open your mouth a little bit? Slightly. Perfect. Okay, relax your arm. Good. Checking for the tendon. Okay. Good. And then can just leave all the weight into my arm. Okay, good. And same here. Good. Good. Okay. Next up, I'm going to palpate your head and your neck and feel for any inflammation of the lymph nodes, any masses that are under the skin. Is that okay? Okay, checking your lymph nodes. Tonsillar, submandibular, and submental. No elevations are noted. Moving down to the cervical lymph nodes. Occipital. Good. Deep cervical in the back. And then supraclavicular. Go ahead and shrug for me. Yep, shrug up. Perfect. And then lower your shoulders. Good. Okay. And then pectoral and axillary. Good. So I'm not noting any inflammations of the lymph nodes. Okay, go ahead and look into the distance for me. I'm going to check your eyes. Good. And now look at my nose. Perfect. And now look into the distance again. Good. I'm going to pull down on your eyelid. I want you to try to look up. Okay. Good. And now look down. Good. Perfect. When did the watery eyes start?
Maybe a month ago.
Okay. I'm not seeing any physiological abnormalities. So we may just treat the watery eyes with some over-the-counter drops.
Okay.
I'm going to assess your optic nerve to be really sure there's nothing internally wrong. Go ahead and look into the distance. Wonderful. So optic disc and optic nerve are intact. I wasn't able to see anything wrong with the retina. And well-defined margins. So eye exam checks out. I'm gonna go ahead and take a look at your scalp next. Have you noticed any itchiness, any redness, any pain when you're brushing your hair or showering? Okay, wonderful. You have very thick hair. I'm not noting any abnormal breakages. And I'm able to visualize your scalp. No redness. Can you move your head towards your left? And then towards your right. Okay. Good. Okay, next up I'm going to take a couple of measurements and note the symmetry of your limbs. May you please elevate your arms just like that. Okay, we're at 72. And 72 and a quarter. Good. You can lower your arms now. I'm going to assess the dermatomes of your skin, and I'm going to touch you with this spatula on your left or right arm. I want you to keep the eyes closed and tell me if you feel me touching you on your left or right side of the body. Good. Good. I'm also going to touch you on your face. Good. Okay. Do you feel this equally on both sides of the forehead? And about the same? About the same? Yeah. About the same? Yes. Okay. Next up, I'm going to touch you with something either sharp or dull. This isn't very sharp, so it won't penetrate the skin, but you will feel a very different sensation. Okay. Keep your eyes closed and say sharp or dull. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Very well. Next up, I'm going to cause a vibration and I'm going to place it at various positions on your body, and I want you to try to localize that. Okay. Good. Wonderful. And now I want you to tell me when you stop feeling the sensation. You don't feel it? Let's try it again. Do you feel the vibration? Yes. Did it stop? Yes. Good. So just say now when you stop feeling it. Now. Good. Now. Good. This is wet and this is dry and soft. So I want you to say wet or soft. Okay. Wet. Soft. Wet. Wet. Soft. Soft. Wet. 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 Soft. Wet. Soft. Wet. Good. I'm also going to focus on your ears. And you said you've not noticed anything abnormal with your ears. Okay. Any discharge or ringing, none of that. I'm gonna just feel around them. Checking the mastoid bone process. And applying some pressure on the front temporal lobes. Good. Does this hurt? And this? No. Wonderful. Go ahead and tilt your head towards your left. Going to take a quick peek inside. with my otoscope. No discharge tympanic membrane has well-defined borders. I'm able to visualize the bony landmarks and just a little bit of wax buildup within normal parameters. Your head towards your right. Visualizing the ear auricle. Gonna take a peek inside. Ear canal is normal, unclogged, no discharge, no redness, and normal tympanic membrane, no wax buildup. Ear exam, scalp and hair normal. Dermatomes and skin, neck and chest, no positive findings. Let's go ahead and check your nose and mouth. Have you noticed any discharge from your nose, any dryness of the mouth? No. Okay, wonderful. Just gonna take a peek inside. No obstructions noted. Go ahead and take a deep breath in through your nose and out. Okay. And do that again. Good. Nostrils are not obstructed. Go ahead and open your mouth and say ah. Okay, good. Teeth are intact and no redness in the back of the throat. Mouth and nose. A pass. I want you to squeeze my hands now. Good. And I'm going to attempt to push you backwards. Don't let me do that. Good. Okay. Let's also do a hearing test. Keep your eyes closed and try to count how many clicks you hear. Good. Wonderful. And now I'm going to make a sound either by your left ear or by your right ear. Go ahead and say left or right. Good, that was a trick question. Good. ahead and lay down, and I'll take a look at your back and your feet and your legs. I'm gonna go ahead and inspect your back first. I'm going to feel for any masses underneath the skin. Good. And now I'm going to palpate your spine. The scapula. And I'm going to percuss. And tap around your spine gently. Good. No abnormal neurological reactions. I'm going to cause a vibration again. Place it on your skin, and I want you to tell me when you stop feeling it. Good. Do you feel it? No. It stopped. Good. So I'm going to assess your feet and your legs next. Is it okay if I remove your socks? Yeah. can I elevate your sleeves, the jean sleeves?
Yeah.
Exposing the knee and the tibia. Your feet are cold. Is that normal for you?
Yeah.
Gonna need a bigger light. Sorry. So looking at the color of the skin and the nails, no clubbing or pitting is noted. Okay. Going to feel the pedal pulse first. And I'm going to cross compare, synchronized, and the popliteal pulse. Good. Palpating for any signs of edema. Good. Checking in between the toes. And can you attempt to bring the toes towards your head? Good. Now I'm going to attempt to spread your legs. Don't let me do that. Resist. Good. I'm going to attempt to bring your feet together. Don't let me do that. Resist. Good. Now can you push into my palms with the pads of your feet? Perfect. And try to push with the heels as well. Good. Alright. Plantar region looks normal. I'm going to go ahead and do the Babinski test. Okay, no positive findings for Babinski. I'm going to go ahead and tap on your legs, tibia bone, metatarsal bones. No abnormal reactions. Palpating the plantar region for any obvious pain. Good. And now push with your toes into my arms. Good. Go ahead and tell me if you feel me touching you on your left foot or your right. Right. Left. Right. Left. Right. Left. Good. Go ahead and scoot up a little bit. Checking the patella in your knees. And and the fibula in the back. And let's check the reflexes as well. If you can just, there you go. And relax the foot. Good. And let's arc the leg. Good. Now I'm going to touch with something that will be a continuous touch. Go ahead and say when you don't feel the sensation anymore. I'm also going to listen to your pedal pulse. Okay, Harita, so did a very thorough investigation. Head, neck, cardiovascular system, ears, eyes, dermatomes, so the neurological connections between your brain and the skin, sensations, legs and feet. So you mentioned that you are on a beta blocker. Yes. That's probably the propranolol. Is that correct?
Yes.
That's usually prescribed for arrhythmia. And do you know how many milligrams you are per day with that?
I'm not sure.
Okay. So I'm gonna write down the smallest dosage and let's confirm at the next checkup.
Okay.
And how many times a day are you taking that medication?
Once a day.
Once a day. Good. Okay. So that completes the assessment.
Okay.
Thank you for coming in today, and let's reassess where you are with your heart in about 6 months.
Okay.
Thank you. Good to see you again, Juliana.
Thank you. Good to see you too.
So today we have an appointment for an annual medical assessment. And when is the last time that you had such a procedure done?
Probably 10 months ago.
Okay. Is there anything in particular that you'd like to address in today's visit?
Yeah, I'm having some pain on my right side, and it wakes me up at night, and it's just on the right side. I usually take ibuprofen for the pain.
Okay. On your chest, your arm.
Yeah, like here, even my face a little bit, and here, my thighs. It's always on the right side.
Okay. Right. Side pain. And when did this pain begin for you, Juliana?
Probably 2 months ago, and has been increasing.
Okay.
When I'm relaxed, usually it's worse. when I'm exercising or doing stuff, I don't feel it. But when I'm sleeping or just relaxing in front of TV, I can feel it.
Okay. On a scale of 1 to 10, how intense is the pain?
Right now, 2. But at night, when I'm really relaxed, when I'm sleeping, sometimes it can go up to 7.
Okay. 7 out of 10 at night. Does it wake you up at night?
Yes.
Okay. And where do you feel it most intense? Is it on your upper body or lower body?
It varies depending on the day.
Okay. Can you describe the pain a little? Is it sharp or dull?
When it's more intense, it's sharp, and also sometimes I have a tingle sensation and numbness a little bit on my hand or my thighs.
Okay, numbness on your hand. Okay. I understand. Okay. Are you on any new medication?
No.
And the last medical assessment that you had done 10 months ago, was there anything abnormal that was found?
No.
Okay. So no positive findings there. Are you allergic to any medication?
No.
Have you had any major surgeries done or any procedures I should be aware?
No.
Okay. Have you tried any ointment or lotion or anything on the skin?
Yeah, I've tried hydrating my skin or some lotion, but it didn't really do much.
Have you noticed any rashes on your skin?
No.
Okay. So let me go ahead and put my medical gloves on. And I will do a head-to-toe assessment today, focusing on the right side of your body. And we'll get to the root cause of what's been ailing you. Are you in any pain right now?
A little bit.
Okay, let me go ahead and just observe your physical appearance first. Okay. I'm just looking at the skin for any external signs, any redness, rashes, any colors that are abnormal. Okay. Let me look on the inside of your arm. And for comparison, okay, I'm not noting any redness or visible signs of edema. Face is symmetric, no discoloration. Okay. Let's go ahead and take your vitals. And I'll start off by listening to your heart and lungs. Have you felt any heart palpitations or any shortness of breath?
No.
Okay. So go ahead and just breathe normally. Gonna listen to your heart. And take a deep breath in and out. Good. Deep breath in and out. Deep breath in. Good, you can breathe normally now. Okay. And I'm also going to check the base of the lungs. Good. Let's go ahead and take your blood pressure as well. Right artery and right here. And you can just lower your arm and relax it. Okay. Okay, blood pressure is a little elevated. 140/69. Have you had any flu-like symptoms in the last 2 weeks or so?
A little bit.
Okay. Any runny nose, any headaches?
No.
Just feeling
Just a little
fatigued.
fatigue, yeah.
Okay. Let's check your levels of oxygenation. Okay, you can leave that there for a second. I'm going to check your temperature. .2, so you do not have a fever. And oxygenation is 99% and 85 beats per minute, so that is good. Just going to make a note of that blood pressure, which was a little elevated, 140/69. Normal temperature and oxygenation, lungs and heart exam, no positive findings. I'm not hearing any hissing sounds or any bronchitis or anything troubling with your lungs, so that's a good news. Okay. I'm going to go ahead and just palpate the right part of your body and see if I can feel any masses, any nodules, any lumps. Okay, just go ahead and relax. Okay. And I'll start with your head. Okay, checking the choroidal pulse, which is normal. And palpating your lymph node, the preauricular lymph node, posterior auricular, mastoid bone process behind the ear, no enlargement noted, submandibular submental lymph node, cervical, supraclavicular, axillary, and pectoral. Okay. No enlargement noted. Gonna go ahead and assess the right clavicle here. And shoulder. Do you feel this equally on both sides of your arms?
Yes.
Okay. And do you feel this equally on both sides of your arms as well?
Yes.
Good. I'm not seeing any reactions of the skin to the light scraping. Do you feel this equally on both sides of your neck? That's 1 and 2.
Yes.
Good. 1 and 2.
Yes.
Okay. And on your forehead, that's 2 and 1.
Yes.
And your cheeks, that's 2.
Yes.
Okay, very well. I'm gonna go ahead and take a couple of measurements and check for symmetry and overall proportions. 22. 12. 28. 27. 33. And can you elevate your hand just like this for me? There you go. 72. and exactly 72. Okay, good. You can lower your arms now. Okay, I'm gonna go ahead and check your eyes. Can you look right here? Okay, that's 1 and 2. Good. And can you look up from him? I'm gonna take a peek at the conjunctiva and sclera. Okay, perfect. So good pupil response there. Size of the pupil in normal eye condition is about 3 millimeters. Good. And I'm also going to check the optic nerve and optic disc. Okay. Go ahead and look into the distance for me. Perfect. Good. Good. Okay. Go ahead and close one eye for me. Cover one eye and look at my nose and count how many fingers I'm holding up. 2. Okay, good. 1. Perfect. Now cover the other eye. Look right here and count. 2. Okay, good. 5. 1. Good. Perfect. So peripheral vision and optic nerve and disc are intact. No physiological damage to your eyes. And good pupil response. Right, I'm gonna go ahead and check out your hearing and your ears next. Have you noticed any ringing in your ears? Anything upsetting you?
No.
Okay. So let's go ahead and just take a quick peek inside. And see if there are any signs of any infection. Can you look over to your left for me? A little bit of wax buildup, but in the normal amount, and tympanic membrane is intact. Good. So no signs of any infection. I was able to visualize the tympanic membrane. I want you to close your eyes and we're going to do a hearing test. And I want you to tell me if you hear a sound at your left or your right ear.
Okay. Left. Right. Left. Left. Right.
Good. And now I want you to tell me if you hear the sound moving towards you or away from you.
Okay. Towards me. Away from me. Towards me.
Good. Okay, so ears are okay. Tympanic membrane intact. I was able to visualize all the bony landmarks and no signs of any infection. Okay, so there's definitely nothing viral or bacterial going on. So I'm going to go ahead and focus on the skin. And we're going to do a series of tests so that I can assess you from a neurological point of view.
Okay.
Okay, so we're going to do a sharp or dull test. And may I have your palm? This is what sharp feels like. It's not going to pierce the skin. And this is dull.
Okay.
So go ahead and keep your eyes closed and say sharp or dull.
Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Dull.
Okay. And now I want you to tell me if you feel me touching on your right side or left side of the body.
Okay. Left. Right. 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 Left. Right. Left. Left.
Okay. Now one object is going to be wet and the other one is going to be dry.
Okay. Wet. Dry. Wet. Dry. Wet. Dry. Dry. Wet. Wet. Dry. Dry. Wet. Dry. Dry. Wet.
Okay. Now I'm going to use my device to cause a vibration and place it on various bony prominences of your body. And I want you to tell me when you stop feeling that vibration.
Okay. Stopped.
Good.
Stopped.
Good.
Stopped. Stopped.
Good.
Stopped. Stopped.
Wonderful. Okay. Now I'm going to spray a very slight, very subtle mist of water on your body, and I want you to tell me if you feel it on your left side or your right side.
Okay. Left.
Good.
Right. Right. Left. Right. Left. Right. Right. Right.
Good.
Left.
Wonderful. Okay. And I'm also going to apply dull pressure on your body, and I want you to use just your right hand and try to point to where I'm touching you.
Okay.
Good. 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 Wonderful. I'm going to attempt to create a scraping sensation on the right side of your body to observe how the skin reacts to that. I'm looking for any excess vascularization or innervation. Okay, so skin reacts normally. Okay, and finally, I'm going to touch you with this object that has two different prongs, and I want you to try to determine if I'm touching you with one or both.
Both. One.
Good.
Both.
Good.
Both. One.
Good.
Both.
Good.
Both. One. Both. One.
Okay, let's try on the inner side of your arm as well.
One.
Good.
Both. 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 One.
Perfect. And finally, I'm going to tap the bony prominences to observe any abnormal neurological reactions. I'll start at the top of your head right here. Okay, good. Checking the eye reflexes. Perfect. Good. Now, can you just open your mouth slightly? Good. Good. Perfect. You can close it. And can you leave your weight into my arm? Very good. Good. And same over here. Just leave your weight into my arm. Good. try the knee. Okay. I'm also going to go ahead and just check your scalp really quickly in this position and observe your responses. As the scalp is stimulated, sometimes we can have more intense neurological responses. So that's what I'm checking for. Juliana, I can lay down now and I can take a closer look at your tummy and your feet. Okay. Okay, Juliana, is it okay if I lower your skirt a little bit and raise your top? Okay. I'm gonna go ahead and check the abdominal area, focusing on the right side here, where you mentioned that you experienced pain and the tingling sensations. I'm going to begin by just doing a visual inspection. Skin is normal. Inspecting the belly button next. How long have you had this ring for?
17 years.
17 years, okay. That looks wonderful. No signs of any infection or redness. go ahead and listen to your abdominal sounds. Go ahead and just breathe normally. I'm hearing activity in all 4 quadrants. Good. I'm gonna go ahead and palpate. Feel for any lumps, bumps, masses. I'm gonna do a light palpation first. And a deeper one. Okay. I'm going to search for the point of maximum impulse on the mid-clavicular line on the between the 5th and the 6th intercostal membranes here. And that's where I can actually feel the pulse right there. Good, that's normal. Okay, I'm going to do a pinching test. Good. Skin reacts normally. And the light percussion. Sounds are a little more hollow and dull on your left side than the right side. Yeah, definitely. No abnormal reactions of your skin. Okay, Go ahead and tell me if you feel me touching you with one or two objects.
One, one, two, one, one, two, one, one.
Let's go ahead and check your feet and your legs. Okay, I'm gonna go ahead and check your legs. And I'm just palpating, feeling for any signs of edema. Feeling the popliteal pulse by your knees. Normal. And the pedal pulse 2+, synchronized. I'm gonna go ahead and do a visual inspection of your skin. Gonna check in between your toes. No signs of nail clubbing or pitting. Good. No rashes or edema in between the toes. Gonna check your capillary refills. 2 seconds. Good. Can you try to curl your toes around my fingers? Perfect. And now can you just wiggle your toes? Perfect. Can you do it any faster? Good. So normal level of mobility there. Can you try to push with your pads into my arms here? Good strength. And can you attempt to bring your toes towards your head? Good. I'm going to go ahead and do a light palpation of the plantar region. I'm going to go ahead and check your saphenous and sural nerves in the plantar region of your leg. Can you feel this?
Mm-hmm.
And this?
Yes.
Good. And this?
Yes. Yes. Yes.
Good. And can you tell me if you feel a mist of air on your left foot or your right foot?
Right,
Okay, good.
left, right, left.
Good. Going to do the Babinski test. Good. Good. Can you tell me if I'm touching you on your left foot or your right?
Right, left, right, left, right.
And now can you say now when you stop feeling the touch?
Stopped,
Good.
stopped, stopped, stopped.
Good. So dermatomes on your legs and your feet are okay. Now I want you to sit back up so I can take a look at your back and your spine. Taking a look at the scalp for any redness, dandruff, or any signs of folliculitis. Not noting anything abnormal with the scalp and no excess breakages. Good. I'm gonna go ahead and just inspect your back and check the curvature of the spine. There is a slight curvature at the bottom. Lumbar spine. Have you ever been diagnosed with scoliosis?
No.
Okay. Just very slight. Just need to keep an eye on it. Okay. palpating your cervical spine. And going down to thoracic and lumbar. Good. Not feeling any nodules or masses in between the vertebrae. Okay. Gonna go ahead and listen to your lungs. Just breathe normally. Okay. No bruit or any adventitious sounds. I'm gonna go ahead and do a light percussion. And a slight tapping on your spinal cord to check for any abnormal neurological responses. Okay. Very good. Checking the skin. Good. Okay, Juliana, this completes the assessment for today. I did a very thorough investigation of your body, head to toe. I focused on the right side and I'm not able to see anything abnormal. But the pain that you mentioned is considerable, so I would want us to monitor that. And I would like you to take an MRI and go into a more in-depth investigation of the right side of your body.
Okay, thank you so much for seeing me today.
Great, I'll see you in 2 weeks after you have the MRI taken.
Okay, thank you.
You're welcome. Okay, so today I'm going to do cupping therapy on your back in order to relax the muscles, improve circulation, and promote relaxation. You mentioned that you have some back pain, Alessandra. Is it localized towards your lower back more so or upper back?
On my lower back.
Lower back. Okay. So I'm also going to be doing essential oil massage therapy and make sure that we relax all of the muscles, scapulas, and that we improve blood flow, the oxygenation in your skin. Okay. Going to begin by putting on surgical gloves. And have you ever had cupping therapy done before, Alessandra?
No.
This will be the first time. Okay. I'm going to begin by prepping the area first. A gentle exfoliation that will make sure that we remove the top dead layer of the skin. And is it okay if I lower your skirt a little bit?
Yeah. I'm first going to inspect your back to make sure that there are no lesions or micro lesions that I should avoid when applying the cupping.
I'm not seeing anything macroscopic. I'm also going to use a dermatoscope. Looking for micro lesions now. So your skin is not penetrated in any way. There are no lesions, nothing that would interact negatively with the treatment that I'm going to perform on you. Okay. Let's go ahead and begin. Take another one now. This one did not stick. I'm gonna redo it. There you go. This one needs to be reactivated. Good. I'm going to apply a little oil. At the location of the suction. magnesium oil to relax the muscles. We'll let that sit in. Spread it around. This magnesium treatment is going to help promote the ease of tension. And after the cupping therapy, it will be absorbed by the skin very fast. Let that pressure push in the oil a little more. Next up, I'm going to do a light massage. Next up, we're going to do a series of tests. I'd like to understand if the sensitivity in your back has been enhanced by the treatment that we just applied. So I'm going to touch you on either your left side or your right side of your back, and I want you to say left or right.
Left. Right. Left. Right. Left. 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 Right. Right.
Good. Okay. And now I'm going to apply some slight pressure on your spine, and I want you to count how many times I am pinching you.
Once. Twice. 3 times. 3. 1, 2. 1. Okay.
4. Okay. I'm going to tap you, and I want you to count how many times you feel me tapping you.
3. 1, 2, 3. 3.
Good.
1. 1.
Good.
3.
Good. Alright, next up I'm going to finish the session with some skin pulling. Just removing the oil.